Hi, Dr. Brian Kaufman, a family doctor and a CLL patient and the Chief Medical Officer at the CLL Society here at the European Hematology Association meeting in beautiful Amsterdam.
And I'm John Pagel. I might not need an introduction to the CLL Society now. It seems like I've been here many times. I'm a CLL physician, researcher. I'm in Seattle, Washington at the at the Swedish Cancer Institute. And I'm here with you in Amsterdam.
Right. And the European Hematology Association Congress happens right after ASCO, and often a lot of the same research is presented in slightly different ways at both sites. One of the new areas that have been interested has been tremendous success in blocking the B-cell receptor through the BTK pathway, ibrutinib being the poster child for that. But there's new ways to do that and new ways to bind at that site that may have some advantages. And could you talk about some of the research that you've seen at ASCO and EHA about those?
I think this is an interesting growing area. It's obviously going to be an approach if these newer ways of targeting or inhibiting BTK, Bruton's tyrosine kinase, pan out. It might be for a smaller patient population, then everybody might be getting an agent like ibrutinib or acalabrutinib or zanubrutinib. But these are interesting drugs in that they work to inhibit BTK in what we call a reversible or reversible format. So with the first generation of these inhibitors, they've really been what we call irreversible binders. And what they do is they get in the binding pocket of the protein of BTK and they stay there and they inhibit it and essentially don't come off. And that's a very effective way, of course, and that's why we've had excellent results to date. However, we also are learning that there might be a benefit to being able to come in and out of that binding pocket to be what we call reversible, such that you might be able to use lower doses of drugs that might be able to target multiple different binding sites at certain spots, and actually even use that as a way to overcome inhibition to a drug like ibrutinib or acalabrutinib. So there are a few drugs that are in more advanced development in this reversible BTK inhibitor space. And the data is starting to emerge. We're learning that the drugs are very well tolerated, which is important. And we're also learning that there's some activity with the drugs. It's early to know how much. We're excited about that. And we're also learning that these reversible inhibitors may be able to overcome the resistance that can develop to ibrutinib or to acalabrutinib. And if people are more interested, there's always this mutation that happens in the BTK binding pocket. Not always happens, but when we become resistant, it's a change in amino acid at space 481. And this is a drug, or a class of drugs that can overcome that resistance. But before I say more about those drugs, I'll tell you that there are a lot of other approaches that are being developed to inhibit BTK that's not direct binding into the cell pocket of the BTK molecule. There are now a variety of approaches in development, actually very, very early but exciting, of actually ways to degrade or degrade the BTK protein without direct inhibition. And the appeal there is that that would even be a more specific way to get BTK inhibition and to interrupt that signaling in the CLL cell that makes it turned on all of the time, and to kill the cell. And hopefully you can kill the cell with less adverse events.
So what we have now are these tyrosine kinase inhibitors. That's the class. So are these degradations, are they a different, is this a small molecule, this be an IV, or do we know yet?
So these are small oral pill molecules in an oral formulation. Again, it's early, but the idea is the science here is very exciting in that you can actually take a molecule and have two portions of it. One portion where you might actually have the degradation component to it, and the other part of the molecule where you're actually targeting BTK in this instance. Or you might imagine in CLL this could evolve to inhibiting PI3 kinase downstream from BTK in the B-cell signaling cascade. And I think there's even a lot of other important targets in the microenvironment of the cell, in the bone marrow or into lymph nodes, that are also excited for degradation and targeting. So they're oral agents, and they're a way to bring in degradation signals directly to the protein, which is BTK, and inhibit the protein by, again, degrading it and causing the cell to die.
This is really exciting research, and I'm so glad it's going on, because it's not a done deal. I mean, in CLL, there's still work to be done.
You know, I think that's the most important thing here. We want to actually use this word that we've always been so afraid to use for so long, and that's cure. We want to cure these people, and actually I think we're really on the forefront of being able to do that with all of these drugs. You know as well as I do that things are really exciting with CAR T cells and everything else that we're reading about, but it's actually the ones that are coming along, the therapies that are coming along, that are perhaps even more patient-friendly and have even greater scientific rationale in many ways, that I think will be major advances towards curing people, and I do think we will cure this disease in our lifetime for sure.
I'm rooting for that, for sure.
Of course,
Yeah.
we all are.
Yeah. Any final thoughts for the patients from EHA?
Yeah, and I think the thing to remember is that not one size shoe fits everybody, right? There are certain drugs that are right for certain people at certain times, and I think one of the most important things is learn about all of these things. Learn about these new drugs coming down the pike, the reversible, what we call non-covalent binding BTK inhibitors. They're easy to read about. Learn about a little about these approaches to degrade BTK and what the science is behind it. It's actually relatively easy to understand, probably a lot easier than I did here. And I would just encourage patients to continue to be your own advocate by gaining information. That's why the CLL Society and what you do is so important.
And that's our motto: smart patients get smart care, and part of that smart care is smart drugs, like some of these are developing, and smart doctors taking care of us.
It's a team effort.
Yeah.
It's a team effort. Thanks, Brian.
Dr. Pagel, thanks.